Now, when we talk about neurotransmitters, first thing, well, what are neurotransmitters? How do they work? Neurotransmitters are chemical signatures. They're the chemical working components of the nervous system. So the nervous system has to work. It's not just anatomy. It's not just the brain and the spinal cord and the nerves. It has working components, and those are called neurotransmitters. Neurotransmitters to the nervous system are just like hormones are to the endocrine system. Hormones are the working chemical components of the endocrine system. With the immune system, we have something called cytokines. Those are the working chemical components of the immune system. Now, we used to teach these as being separate, and we developed disciplines throughout the years that addressed each of these. So if you have a thyroid problem, you go to, because the thyroid is an endocrine gland, you go to an endocrinologist. If you're having some sort of brain-based problem, you go to either a neurosurgeon or a neurologist, because he's the one that deals with these. Well, and we really don't have any working immunologists, so if you have any kind of immune-oriented problems or autoimmune disease, you go to see a rheumatologist and get steroids. But that's a whole different piece. What we now know is, because we started getting confusion with some of these working chemical components, because what we started to notice was that, well, sometimes hormones act like neurotransmitters, and sometimes neurotransmitters act like hormones. And it was getting kind of difficult to distinguish, well, which one is it really? And then we started learning more about the immune system and cytokines, and really kind of found out that, you know, these guys all speak the same language, basically. And they all have very similar actions. And you can't alter one without altering the others.